Happy Wednesday, everybody. I am very excited that I'm going to get to actually speak at the FAST conference, which is super exciting, in Lexington next week, so that'll be fun. And I'm going to do a lecture that focuses on what I would say are the 5 main points, not the only ones, I, of course, caveat with that, that are different for transporting a pregnant person rather than transporting someone who's not. And I also emphasize that in most other ways, they're not different. So don't be afraid to treat patients as if they're not pregnant for things like pain, which I've said many times. But the 5 differences that I'm going to talk about are airway. So having more likely to have a difficult airway, as in more likely to have edema of the glottis even, more common in preeclampsia, as well as having just in general more consumption of oxygen and therefore not a long time to desaturation after paralysis. So I see that more in the OR, right? I don't intubate people, but I would say that, you have to have the most experienced person doing the airway and you have to be ready for them to desat fast. The next one is blood that I was going to talk about. And so that's both the fact that they have an anemia of pregnancy, which is normal, and also a respiratory alkalosis, which changes your blood gas parameters for what's normal. And also having more propensity to clot and also to bleed. So therefore having more propensity for DIC, really because of other pathology of pregnancy, things like abruptions, intrauterine fetal demise, those kind of things can, and like just chronic bleeding stuff, lead to DIC more commonly. So it's more like the pathology of pregnancy, not great things that can happen, can lead to DIC more commonly. And then the C is child, right? So I'm going to talk a little bit about how you do a normal vaginal delivery and how you would manage both the shoulder, as in Mick Roberts, and suprapubic, meaning pull legs super, super far back, flexing the knee and the hip as much as possible. Really the hip is what you're trying to do. And also putting pressure on the side where the shoulder is. So if you see the ear up on the, let's say, so that the left shoulder is up, you're going to put pressure from mom, I'm trying to do this in my head. So that would be there. So left would be there. So from mom's right side, or, if you're standing up from the left. So the point is to push the shoulder down that is up. Yeah, see, you got to really look at it in person. I'll have a picture of that one for sure. And then also breech delivery, I always talk about it. But usually mamas that are, delivering in the field, it's their 5th or something, thank the Lord. And so it's not as big of a deal. And then I will talk about the other 2 that I was going to mention are DKA, that those with type 1 diabetes can have DKA at a much lower number. So they can have a sugar of 200 or something and still be in DKA. So definitely still looking for that or thinking about that.